Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. So for a patient who suffers from chronic otitis externa, so otitis externa is an umbrella term for an infection of the outer ear. So otitis just means ear infection and externa means the external part of the ear. And so what that means in real terms is an infection of the outermost layer of the eardrum, or an infection of the ear canal, or an infection of the external pinna. So that's a satellite dish, the cartilage that is visible externally in our ear. Otitis media is an infection of the middle ear. So the middle ear is the cavity behind the eardrum. Now this patient actually resides in Singapore. Currently they're in the UK, so they typically get treated on a regular basis by some ENT consultants in Singapore. She advised that they're actually from the UK originally, and they've set up a clinic in Singapore. And they got recommended to myself to have their ears cleaned whilst they're in the UK. Now, they actually attended for primarily treatment in the left ear. They did recognise that their right ear was blocked. By the way, this is the second time I've seen the patient. They came about a month ago prior. And you can imagine just how frequently they need their ears cleaned, because this was totally cleaned just a month ago. And they primarily attended to have their left ear cleared. And the reason for that is that they got water in their left ear, and they're fully aware that they should avoid water in the ear. But unfortunately, they did get water in the ear, which caused their otitis externa to exacerbate in the left ear. And you'll see in a moment when we've done the right ear, when we do the left, that the entrance of the ear extremely tender and inflamed. So we're just starting off with, well, I actually did the procedure in the left ear first when the patient attended, but for the purposes of the video, I'm showing you the right ear first. And you can see this right ear, there's a lot of debris here, a lot of dry skin. So this is not really earwax, this is all dead skin that we're removing. When someone's got otitis externa, there's different types. The most common type is a bit like psoriasis or eczema, so it's very superficial. You get just loads of dead skin just dying in the ear. This skin collects and it forms into little plugs like this, and it gets a bit damp and wet, and it just ends up blocking the ear. Then you can get a more severe otitis externa with edema, inflammation. So you kind of call that deep otitis externa. And then you can get really, really dangerous otitis externa, we call necrotizing otitis externa. So that's the most severe form, or it's sometimes known as malignant otitis externa. And that's when the ear canal and the outer is so badly infected. I'll come back to that in a moment. So you can just see the eardrum there, just a bit of dead skin that I'm going to peel now using a fine end suction probe. Yeah, so going back to necrotizing and malignant otitis externa, that's when the ear infection itself can be so severe that it can start affecting structures around the ear canal, so your jaw, your cheek. It can go upwards sometimes. It can go to the mastoid bone, to the bone behind the ear canal. It can be very dangerous, actually. It can, in this extreme case, it can be life-threatening. People who experience necrotizing otitis externa are typically those who are immunocompromised, people who are diabetic, and the elderly. So typically, if you are immunocompromised, diabetic, or kind of in the elderly bracket, we kind of advise you to not have your ears irrigated. In the UK, it's falling out of favour anyway. Now, so the right ear's done. This is the patient's left ear, and you can just tell by the entrance this is a lot more inflamed. Now, there wasn't as much occluding debris, so there was a bit of debris more laterally, just blocking the entrance where we are here. We've removed that already. And what I'm going to do now is just trying to mop up as much of the soft, dead skin, wet skin that's coating the canal as possible. You can just tell by the colour of this ear canal, it's a bit more red, a bit more angry, especially at the entrance. It's a lot more inflamed, tender. Now, they have got medication already for their otitis externa from their ENT consultants in Singapore. So they're going to be using that after, obviously, I clean the ear. Now, I've got the debris, the main occlusion out. I just want to mop up as much of this soft dead skin, debris that's accumulating on the ear canal. I'm using a Jobson horn to do this. It's because of the consistency, it's a bit sticky and gooey. You can tell there just when I'm scooping it. Jobson horn's a bit, I would say, a better tool to remove this than suction. And because we're on the cartilaginous portion here, we can apply a bit of pressure, so it's not going to be uncomfortable for the patient. Now, if we did this on the bony part of the ear canal, yes, of course, that's going to be really uncomfortable. And that's because the inner 2/3 of the ear canal, what we call the bony part of the ear canal, that is very sensitive. There's no buffer, there's no cartilage or fatty tissue there. It's simply a very thin layer of dead skin, a thin layer of skin, should I say, not dead skin, but skin, less than 0.1 millimeters in thickness, and that directly coats and sits on the bone. So there's no buffer there. Whereas the outer third, where we are now, there's a thicker layer of skin, about a millimetre in thickness. There's cartilage there, so there's a bit of a buffer. Cartilage is a bit more flexible than bone. And see, I'm just using this Jobson horn. Has got other names. It's got most typically an ear correct. And there's just a bit of debris there, just at the base of the ear canal again, because we're on the cartilaginous portion. We're near the juncture there, the bony part and the cartilaginous part, what we call the osteocartilaginous juncture. So it's just going to be a bit gentle there. And so there's a bit of debris on the right side of the ear canal, which I will get in a moment. Now, incidentally, you'll see in a moment the patient's left eardrum, and the bottom left corner of the eardrum is slightly bulged. I don't think there's any, well, I know there's not any fluid behind the eardrum, so you can sometimes develop glue ear, and glue ear can cause a bulging of the eardrum, because I did a pressure test to ascertain whether there is fluid behind the eardrum. We call it tympanometry. We play a sound in the ear, we change the air pressure, and we just measure the movement of the eardrum and how much sound is absorbed into the ear via the eardrum and the three little bones. It's a test called tympanometry. It takes all but 2 or 3 seconds to perform. And if someone has got what we call glue ear, so fluid build-up behind the eardrum, so otitis media, the eardrum wouldn't vibrate, sort of vibrate very minimally. And this patient's eardrum was vibrating very well within normal range. So that bulge, I think, they had a little bit sniffly, and I think, well, the patient did advise they've been blowing their nose a lot. So I think they've been blowing their nose, they've been forcing air up the eustachian tube, and you'll see the bottom left is a bulge, the eardrum bulges out. So they've just been blowing their nose, and they just had a bit of excessive air pressure trapped in their middle ear, so the eustachian tube probably is a bit blocked, and they managed to force air up the eustachian tube, and the eustachian tube then blocked itself, so it's unable to equalise. So just advise the patient to perform what we call the Toynbee procedure. So the Toynbee procedure is when you pinch your nose, close your mouth, and you swallow, and that kind of almost sucks air out of the middle ear. The opposite to that is the Valsalva, and that's when you pinch your nose, close your mouth, and blow into your nose, and you force air up your eustachian tube to aerate the middle ear. And also the patient has got some nasal decongestants, because again, it's something that they do suffer chronically from. So they're going to use the nasal decongestion sprays to help them block that eustachian tube and allow the middle ear to equalise itself. Well, I hope you enjoyed that video, guys. Take care. I shall speak to you soon. Bye.